Did you know that 1 in every 8 known pregnancies will end in a miscarriage? Welcome to All Round Health Talk with your girl, Dr. Oninye. Remember, this is a channel where our health is our priority. Today, we're going to be talking about a very delicate topic, but yet very common. We're going to be talking about a miscarriage. Now, medically, we refer to miscarriage as early pregnancy loss or spontaneous abortion. But for the purpose of today's video, we're going to stick with a very common terminology, which is miscarriage. Now, before we get right into today's video, don't forget to subscribe to my channel. If you haven't subscribed, what are you waiting for? Subscribe to the channel, put on your notification so you get notified for every single time I post a video. Now, let's talk about miscarriage. Miscarriage is a loss of a pregnancy before the pregnancy is 20 weeks old, which means this is a pregnancy that is lost before the pregnancy is 5 months old. Now, miscarriage is so common. I believe that every one of us knows a woman that has experienced a miscarriage. And many miscarriages happen even before the woman realizes that she is pregnant. But it's also important for us to know that within the first trimester of pregnancy, light vaginal bleeding is very common. And this does not necessarily mean that you're having a miscarriage. However, my advice is that if you are pregnant and at any point in your pregnancy, you're experiencing any form of vaginal bleeding, get checked out just to make sure that your fetus is doing fine. All right? What are the causes of miscarriages? Now, the cause of miscarriage is not well known, but one thing we know is that 80 to 90% of miscarriages in women is as a result of chromosomal issues or genetic problems. It's either the fetus has excess chromosomes or has insufficient chromosomes. This is very important because the chromosomes represent the genetic properties of the baby, of the fetus, of the embryo. Now, these genetic properties is a combination of genetic properties from the mother and genetic properties from the father, which means that every one of us is a unique being with unique genetic property, but our genetic representation is a combination of the genetic properties of our father and our mothers. So, a woman is not the only person who provides genetic properties for her baby. That's why we need to stop accusing women whenever they experience a miscarriage. Genetic problems are not things we can control. So, we do not know the real causes of miscarriages, but irrespective of the fact that we do not know what the causes of miscarriages are, we know that there are certain risk factors that can increase a woman's chances of having a miscarriage. One of these risk factors is advanced age. The older the woman, the higher her chances of having a miscarriage. Studies show that women between the ages of 20 and 30 have a 9-17% risk of having a miscarriage. However, a woman who is 45 years or above has a 75% to an 80% risk of having a miscarriage. Another risk factor is history of a previous miscarriage. A woman who has had a previous miscarriage has a higher risk of having another miscarriage. A woman who has had one miscarriage has 20% chance of having another miscarriage. A woman who has had 2 consecutive miscarriages has a 28% chance of having a third miscarriage. And a woman who has had 3 or more miscarriages has a 43% chance of having another miscarriage. Another risk factor is first trimester bleeding. Any woman who suffers from first trimester bleeding is at a risk of having a miscarriage. Also, certain chronic diseases such as obesity, diabetes, thyroid issues can increase a woman's chances of having a miscarriage. Also, we have infections such as syphilis, infections such as Zika virus or cytomegalovirus can also increase a woman's chances of having a miscarriage. We have chronic stress. Being exposed to chronic stress during pregnancy can increase chances of miscarriages. And then we also have lifestyle activities such as smoking, drinking, doing drugs, or taking a lot of caffeine during pregnancy. In this case, we're talking about women who take more than 3 or more cups of coffee on a daily basis while they are pregnant. All of this can increase your chances of having a miscarriage. And last but not the least, we also have environmental contaminants like lead, arsenic. They can also cause miscarriage in women. So you need to be very careful. Now, how do you know that you're having a miscarriage? What are the symptoms of a miscarriage? Now, there are 3 main symptoms of a miscarriage, which is vaginal bleeding, abdominal cramp or abdominal pain, and the passage or elimination of the tissues of the fetus or the embryo. These are the three main signs of a miscarriage. However, sometimes this abdominal pain or abdominal cramp can be found in the two lower quadrants of your abdomen, and sometimes the pain can radiate to your lower back, to your buttocks, or your genitals. Now, it's important for us to know the characteristic of this pain. If you're having vaginal bleeding and you're having abdominal cramp that is focused on one side of your abdomen, it might be an ectopic pregnancy or an ovarian cyst. Any form of vaginal bleeding, abdominal cramp must be checked out by a physician. There are other symptoms we can look out for, but that will be based on the type of miscarriage. There are different types of miscarriage, and so symptoms will be based on such miscarriages. For example, we have what we call the missed miscarriage or the asymptomatic miscarriage. This is a woman who is having a miscarriage or who has lost her pregnancy, but she's not bleeding, she's not having abdominal pain, and she's not eliminating any tissues of the fetus. So she's not having any of the signs of a miscarriage. A woman might actually have a miscarriage and not know it until maybe she goes for a scan, and then the doctor identifies that the fetus does not have a heartbeat or the fetus is not viable anymore. Now, apart from a miscarriage, we also have a threatened miscarriage. Now, this is more like a threat. It's not like you're having a miscarriage. What would this look like? This would look like vaginal bleeding, abdominal cramping, but the cervix through which the tissues of the fetus or the fetus itself will come out is closed. All right, but then you go for a scan, it shows that your fetus is intact, your fetus is alive, but you're having the bleeding, you're having the cramping. That is a threatened miscarriage. It's a threat. If you do not take care, if you do not follow all the indications of your doctor, it might actually end up in an actual miscarriage. Then we also have the inevitable miscarriage. This is where we cannot stop this miscarriage from happening. You're not passing out any tissues yet, but you're bleeding, you're having cramp, and your cervix is open. Once your cervix is open, the risk of the fetus surviving is very low. That is an inevitable miscarriage. Then we have the incomplete miscarriage. This is where you're having your bleeding, you're having the abdominal cramp, your cervix is open, and you have eliminated some of the tissues of the fetus, but some remnants of the tissues of the fetus stay behind in your uterus, and that will be seen through a scan or a diagnostic D&C. That way, you have eliminated some part of the tissues of the fetus, but some of them are still left inside. So that is an incomplete miscarriage. And then we have the complete miscarriage. This is where you're having the bleeding, you're having abdominal cramping, and you've eliminated a complete fetus. All the tissues of the fetus is out. And then your cervix has now closed up, and the scan shows us that your uterus is empty. So that is a complete miscarriage. And then we also have cases of a septic miscarriage. This is where a miscarriage has been complicated by an infection. So not just having the normal signs of a miscarriage, you're also having fever, you're having chills, and you're having yellowish vaginal and cervical discharge. The symptoms of a miscarriage can vary depending on the type of the miscarriage. Now, how would your doctor know, confirm that you're having a miscarriage? Obviously, through your symptoms, right? And through doing a scan. But also your doctor would want to do a lab test just to know how your platelet levels are, how your hemoglobin levels are, to see if you've lost a lot of blood and you are now anemic to the point of needing transfusion. Your doctor will also do a beta HCG test to actually determine if you are pregnant. Actually, in any hospital setting, a woman who is in her reproductive age or her fertile age who comes in with an abdominal pain and vaginal bleeding is suspected to be pregnant. So a beta HCG will be done just to make sure that you are not pregnant, or to determine if next step should be a transvaginal scan or a transabdominal scan. For example, if your beta HCG is between 1,500 and 2,000, then definitely a transvaginal scan is the most recommended next step. And if your beta HCG is over 3,000, then doing a transabdominal scan can also help identify the uterus and see if there is a fetus there or not. Apart from that, your doctor will do a blood type test and a screening test. This is to identify your blood type in the case of a transfusion, but also it will do the screening to identify what is your rhesus factor, if it is negative or positive, to know if you need to get the diagnostic D&C. A woman who has the rhesus factor that is negative with a husband who has a positive rhesus factor is at risk of having immunologic response due to the different rhesus factors. And then urine tests will be done to identify if there is any infection that could have led to the miscarriage, so that that infection can be treated. And in some cases, we might need to do a diagnostic D&C to determine if there are remnants of fetal tissues that needs to be eliminated. Now, the treatment will depend on what kind of miscarriage you're having. If you've had a complete miscarriage, then there'll be no treatment, no medication. You'll be left for observation. You'll be able to go home within 24 hours. But the only reason they might need to do any treatment is if maybe during the complete miscarriage you lost a lot of blood and now need transfusion. And so transfusion will be done. Medication can be used in the case of an inevitable or incomplete miscarriage, such as misoprostol, to help with eliminating the remnants or tissues of the fetus. And then a D&C will be done in the case that maybe the inevitable and incomplete miscarriage does not respond to medication. And so that would be the next step. Knowing all of this, the most important thing is, how do we prevent a miscarriage? We've already said it that a miscarriage is not a woman's fault. 80 to 90% of miscarriages are as a result of genetic defects. We cannot change genetics. However, there are certain lifestyle changes that we can implement, especially once we decide that we want to get pregnant. You don't have to wait until you're pregnant to make these lifestyle changes. When you start trying to get pregnant, you should already have made these lifestyle changes. Prevention of miscarriage will include: avoid drinking alcohol, avoid smoking, avoid doing drugs. If you are obese or are overweight, start carrying out physical activities, get a nutritionist to help with your diet. And if you have any infection at any point in your pregnancy, make sure you get treated, because infections are very common during pregnancy. Any sign of infection, any sign of a chill or a fever, or any kind of symptom that is not really typical of pregnancy, please go get checked out. And if you suffer from any chronic condition like diabetes, thyroid issues, make sure that you're constantly taking your medication to ensure that your condition is under control and does not affect or impact your pregnancy negatively. But to end, it is important that we know that women who suffer from miscarriages should not be stigmatized. They have no fault in it. It is something that generally cannot be controlled. We can make lifestyle changes, which most women do when they are preparing to get pregnant, but genetic factors cannot be altered. Please stop the stigmatization of women who suffer miscarriages. If this video has been interesting, educative to you, please make sure to subscribe to my channel and put on your notifications so that you get notified for every time I post a new video. Also, share this video to as many people as possible. We need to get educated on miscarriages. There's so many perceptions about miscarriages that are so wrong. So share this video so more people are enlightened. Also, give me a thumbs up to show me that you love the work I'm doing and to actually motivate me to do more. And then make sure you leave a question or a comment in the comment section. I'll now get right back to you. Thank you, and I'll see you in the next one. Bye-bye.